My name is Candace Boutel. I am with Inspire Sheboygan County, and we're excited to have you all today so that we can talk about the career of nursing in an urgent care setting. And we have Amanda Rosinski here from Advocate Aurora in Two Rivers. So, Amanda, welcome and thank you for being here. And if you want to start off just by telling us about your own career path and how you got to be where you are today.
You bet. Can you all hear me? Just doing a little sound check.
Yes, sounds great.
Yes, perfect. Yeah, so as Candace introduced me, I'm Amanda Rosinski. I currently serve as a supervisor of clinic operations for urgent care, some of our primary care clinics, and I work through Advocate Aurora. My career path, I started early. I was in a careers course in high school myself and trying to figure out my path and did a bunch of personality tests. And it actually showed that I should be a funeral director based on communication. But I wasn't very interested in that realm. And so I ended up going through counseling and chose nursing as my profession. So my career path, I started as a dietary tech working in a local assisted living for Theta Care, which is a large healthcare organization seated in the Fox Valley. I then became a CNA and an LPN. Then I was an RN, a charge nurse, a supervisor, and a manager. And I worked for 18 years for Theta Care within the acute inpatient setting, so general medical patients. And then when I graduated with my master's degree, I was looking for an opportunity to move to the ambulatory setting, which is a setting that is outside of the hospital. As we look at care shifting and trending, that is where a majority of our care is going to be spent in the future. So I figured that it was a good opportunity for me to try something different, exercise my master's degree. I took a different opportunity. My husband's job was relocated temporarily out in the North Dakota area. So I took a job managing 14 primary care clinics in the Fargo, North Dakota, northern Minnesota. So I worked through primary care. I did that for about a year, but then we really were missing our family, who is seated here in this great state of Wisconsin. So we came on back. I came amidst the pandemic in April. I joined the Advocate Aurora team and serve currently as the supervisor of clinic operations for urgent care in Manitowoc, Two Rivers. I am also oversee primary care for Valders, Mishkat, Two Rivers Clinic, our call center, and I serve as a HIPAA compliance officer for our county. So that's kind of a little bit about my path and where I ended up and what I'm doing today.
Fantastic. Thank you so much. And I always love hearing from people who have gone down the nursing path. I love hearing when you started probably way back in high school, you said that careers course, and then a CNA, a dietary aide before that even. And I think that that's so useful for the students to understand. I'm actually going to jump ahead. So we are getting some questions, and students, please continue to add your questions into the chat. I want to touch on something that I don't think we've talked a ton about with any of our health professionals. How did you know that the management route was for you? And how is that different from like the patient care piece of things?
Yeah, so very interesting. I've had a number of leaders in my career path and in my time. And fortunately, the leader that I had was very invested in my professional development. So I was trying to figure out at this time when I was serving as a clinical lead in that entry level leadership, I always have possessed a thirst for learning. And so always wanting that challenge and to do new things and experience how do we better patient care. I was actually enrolled in a master's degree program to complete my nurse practitioner degree when my my leader said to me, you have a very natural knack. You're an informal leader on this unit. People follow you. I think you could do some amazing things with a leadership degree. Would that be something you would consider? What opportunities can I put in front of you? So I got invested into some different committees and helped to do some process improvements to improve patient care, was more engaged and involved in partnering with things, took on that clinical lead role, was working in that, and then I became that supervisor. So when you enter a master's degree program, there's a certain series of classes that are the same no matter what, but then you got to make a decision as you get further on. Am I going to go and do the clinical aspect of this? And for me, I wanted for myself to impact patient care. If I were to become a nurse practitioner, it would have been one patient at a time in my practice, and patients can choose to be compliant or not compliant. By being a leader, I am able to grow and develop and kind of showcase and ensure that the care that we provide to patients is following evidence-based practice, that I am coaching, mentoring, and developing quality nurses who are serving our communities. So in essence, my impact and my legacy is going to be much bigger with the privilege of being a leader. So the differentiator, to sum it up, was that I had a great leader who realized the potential in me, saw something I did not see, and I chose to pursue it. And so then ventured out into my master's degree with specialization in leadership and management. And I think that piggybacks to nursing is so diverse. There are so many things you can do with it.
Yes, and that is definitely a theme that we see often through this career path is there's so much flexibility. There are a lot of different ways to move up and around within your own path, depending on that. So students, if you already have taken on leadership roles in a lot of different ways still as a student, you can kind of have that in the back of your mind as a potential, place for you to go as you go down this road. So I'm just going to start from the top here with some of our questions. What is it like working in urgent care?
Urgent care is an amazing place. So as I said, we are transitioning care outside of the hospital as we look at trends. The whole idea is to keep people well and keep them out of hospitals so they're not getting some of those nosocomial infections, which is otherwise known as a hospital-acquired infection, that we're keeping people well. So here in the urgent care, we're very busy. We kind of, to best describe it to you, run somewhat like a mini ER, but we are confined to what we can and cannot do. So currently within this pandemic, we're serving probably upwards of 100 plus patients, and we are seeing COVID positive symptoms, those types of things. And so the thing about urgent care is you never know what you're going to get. It's not your scheduled cookie cutter, here for my wellness check, here to, see my primary care provider for a physical, that sort of thing. It's people that are traveling through that may not even be living in Wisconsin that are here visiting. I got a fish hook in my foot this weekend, and the urgent care is, we're open 365 days a year. We are serving our community. So you see everything from very interesting little injuries to, I have an established growing trend within medicine that we're seeing. Our folks are reluctant or not establishing care. So when they don't have a primary care provider, who do you go to? So the urgent care is helping to serve our communities and fill that gap. It's unscheduled care, so it's not really predictable. The only thing that we can count on for certain is scheduled lab appointments. But we are serving all the way from teeny tiny babies up to, end of life here in the urgent care. And it's a very interesting, fast-paced, ambulatory environment. I require all of these nurses to be ACLS certified, which is advanced CPR training. We have great relationships with our local hospitals, and when patients warrant further levels of care, we get them sent over there via the ambulance and that sort of thing. Does that help to answer a little bit about?
Yes, that is exactly what I was going to ask about, like the things you can't do, then you send them on obviously to the hospital, wherever they need to be. Wonderful. All right. So Kylie was asking, was it difficult to transition from assisted living to a more clinical setting like urgent care? She was saying she works in an assisted living now, but is looking to move on. And maybe just to add to that, I think to give students perspective on why you make those changes in your career. So we often see that you have this path that goes, various ways. What is it that makes you choose those changes and choose to move in another direction?
So it wasn't difficult because I had that thirst for learning, and I was eager to, I wasn't a hopper with my roles. I stayed that 18 years within that Theta Care system. It's all about your personal development. So, early on, many times that entry-level job is a dietary tech or a CNA, and that's laying the foundation to your career to understand basic care needs of patients and what needs to be done. But I was hungry for more. There was more to what I was wanting than just doing the activities of daily living, bathing, toileting. So it was me seeking out opportunity to be able to advance my skills. I mean, you have to bridge, right? So there's new competencies, there's new roles and responsibilities. I think it's really important, as they alluded to in the very beginning of this presentation, that you have excellent communication. You have to be your own advocate and speak up. Talking about when you don't understand something or this is the first time, using polite and careful conversation. Oftentimes, even in this role, I'm not new to leadership, but I'm very new to Advocate Aurora. It came in the midst of the pandemic when nothing was the same, right? So I oftentimes, when I have a question, instead of saying I don't know, I use lingo of can you please educate me to how Advocate Aurora does this, or can you walk me through this? And that is perceived by my colleagues as a better way to approach it, and I get a better response. And then I'm still growing professionally. It's all about having that positive synergy and that willingness to learn, and demonstrating that you're trying to better yourself and you're trying to do the right thing, and you're just equipping yourself with the right tools. Did I hit
Wonderful.
all those points, Candace? I kind of
That's
forgot the
fantastic.
question.
Yeah, right. No, we're on the right track. And I mean the questions always come in fast and furious, which students, awesome job. So here's how I think we're gonna do this. We'll keep talking more about like what it's like in these roles. And then students in a little bit, we'll transition to the education side of things and give you suggestions on how to go down a path that way. So let's talk again about your day to day. Joseph was wondering, or even throughout your whole career, when were you most challenged?
I think the biggest challenge that I experienced, so working that 18 years, I worked with the same group of folks. And the transition point when I moved from being their colleague and their buddy on the floor to needing to be the boss. That's a really hard transition because you understand what it is like to be working on the floor. You know the struggles that they're encountering, and now that relationship needs to change. So I needed to very quickly establish some firm boundaries that were professional. And I accomplished that through just being clear with them and demonstrating that they could trust me and that I was going to advocate and keep the needs of the unit, as well as putting patients in the center of everything that we did, first and foremost. So that was most challenging for me. I think it took me 6 to 8 months to finally feel like I was succeeding. And that was one of my things that I even brought up when I interviewed for that position is, should I be looking for a position outside of this unit, given the history and that I've served on this floor. It serviced me very well in that I already had the trust and buy-in because they knew who I was as a nurse. They knew the care that I provided. They knew that I knew what was happening and what that work felt like. And it has made me a better leader to work all of the positions that I have in my time, because I understand where different team members are at. Whether you are a fresh CNA, I know you're terrified to be in a hospital. The first time you encounter a code or have your first patient death, you're going to need some help, because I was there. It's terrifying, there's not always good outcomes. Being flexible and open to whatever opportunities that have helped to groom and guide me have only helped to make me more successful as a leader and help me to be more open and be better for my team members, because that's really the priority. Number one, patients in the center of all I do. Number two, if you can cultivate and grow a strong team, you can achieve anything.
Yeah, that's wonderful. And Haley had a question kind of along those lines. What are good traits nurses should have to be successful?
I think piggybacking off of, communication is really important, critical thinking. Nursing, one of the most challenging things about nursing is it's not black and white. Even when you're preparing and studying to become a nurse, it's not simple. There's critical thinking and elements of, you have to understand something to interpret it, because patients aren't always forthcoming with information. You got to kind of fill in the gaps. And it's important that you understand medicine and assessment, and that you're critically thinking through patients. So critical thinking and good communication. It's okay to be vulnerable. And what I mean by that is, there was times when I was a fresh nurse that I knew something was wrong with this patient. Something doesn't feel right, but I can't figure it out because I'm brand new. I don't even know where the bathroom is, it's rough. So you go and you find someone who can help you through that, because you got to be safe. You got to be safe. So it's all about, once again, I can't overemphasize, putting the patient at the center and just critically thinking, good communication, critical thinking, a thirst for learning. You really have to be eager to understand and not be afraid to fail.
That's wonderful. Those are all great. And students, if you notice, we're talking about those soft skills. We're not talking about, oh, you have to have, this grade point average and you have to have taken, like, that all comes with it. But it's those soft skills of being able to work with other people and certainly doing that patient care, which is
And Candace, to
essential.
piggyback off of that, here's the thing. When I have been in a hiring position now for quite some time, and I am not afraid of new grads, but I'm telling you, the the person that I'm going to pick when I interview, I can teach you how to be a brain surgeon if that's what I need. I can teach you those skills, but I cannot teach you to have the natural things that should have come. I can't teach you to be kind. I can't teach you to possess good communication skills. I could give you the subsets in medicine to make you successful, but those people skills really set people apart. Paying attention to detail and being polite and honest and forthcoming and eager to learn. Those are the most important things.
Awesome. That is great. Okay, so I know we had talked about the fact in urgent care, you never know what's going to be coming in. There's all types of different patients. Can you walk us through sort of the specifics that an RN tasks they would be doing on a typical day in urgent care?
Sure. So would it be all right if I kind of walk you through like what a patient would, if you were to come to my urgent care, what would happen?
Yeah, that'd be great.
Sure. So currently amidst the pandemic, our workflows are a little bit different because we are seeing patients with COVID symptoms. And so upon presenting to the urgent care, you'd be greeted by one of our patient service reps at the front desk, and they're going to ask you some basic check-in questions. Patient is provided a badge. We have self-rooming as a capability, and that's helping us to keep in alignment with our safe care promise and separating patients that triage or screen to be either potentially COVID positive or negative. We don't know based on that conversation, but there are rigorous guidelines that we follow to sort them out. So patients are given a badge that they clip on their clothing, and we exercise something called a VCE system. It's in our ceilings and in all of our rooms, and it's a sensor. And I apologize, mine is at my desk, but it will show up, if my team was looking for me right now, if I had it on my badge, it would show that I'm in this conference room and they would know where I was at. With that being said, I can also see where all my docs are, where all my nurses are, where those, PSRs. It doesn't show when they're in the bathroom. That's a funny question I sometimes get. But it shows in these main core areas, if I notice that there's 3 or 4 staff members in this room and I haven't heard a panicked call come out, I might want to go check because that's not typical. What's going on in there? So the patient would be given instructions which hallway to go down to enter, and they would self-room, and they're instructed to close the door, and that sensor permits us to know that there's a patient sitting in there. At that time, the nurse, typically an RN, but I do have LPNs and 2 MAs that work for me. They would enter the room, and they would go through a standard rooming process. So they would ask the patient questions related to their visit, do some typical history and physical questions, about the COVID screening questions, have you been tested? Are your feet blue? Any coughness? All that. Cough, shortness of breath, that sort of thing. In addition, they would complete some of our health screening things. We do a depression screening called a PHQ-9. And we also do like a safety. There's some things that are regulated and outlined. So they would perform screening questions. They would obtain vital signs. And then based upon what the patient is here for, let's say that they have a laceration or something, that's going to depend. We would specifically send them to a procedure room versus a regular exam room. They will try to prep and anticipate based upon what they're hearing from that patient, the provider is going to need or what's going on, but they will complete that rooming process usually within 3 to 5 minutes of that patient entering that room. So upon completion of that rooming, they come back out, and my unit is designed in such that the providers and the nurses are sitting in this centralized core, and the patient rooms are on the outsides surrounding us. So patients enter from the outside, the nursing staff and providers enter from the inside of the core out. So it's a very unique design and helpful in providing this level of care. So then the provider would go in and see the patient and assess whatever they are here for, and they would come up with a treatment plan. Maybe the patient's blood pressure was high upon that first check, so then my team needs to recheck that blood pressure. Maybe they need an ear flush. They have something going on, but they would be treated for whatever they are being seen here for. So if they need to go to a diagnostic, we run labs on this site. So we would carry out the provider's treatment plan. And then there would be collaboration between the provider and the nurse in, okay, this is what I'm thinking for patient A, and they would go and perform whatever tasks are assigned and then re-follow up with the patient. Then an after visit summary would be printed, and the patient would be sent on their way wherever it needs to be. Urgent care, the beauty and kind of the fun of this fast-paced unit, in my acute inpatient medical experience, you could have the same patients for a couple days a week, depending on what's going on, if you're working several days in a row. Here in the urgent care, we try to get them in and out within 60 minutes. That's my expectation with my team members, because this is a fast-paced, that we're not a primary care clinic. We're not having really long talks. We're trying to get them compliant with things, but we are, that fast medicine, so to speak, sending out the treatment. Patients are then provided their prescriptions and any information or literature, as well as direction to follow up. As a result of this, we want you to follow up with your primary care provider. If they don't have a primary care provider, we in turn have our patient service rep who checked them in. We provide them with that information and maybe help to establish that appointment before they leave, because we have better compliance with patients if we catch them before they walk out the door. Secondly, if we have patients, oftentimes we have patients that come in with financial concerns. I have a financial advocate that works for me, and they help to ensure that patients are not worried about how they're going to pay for this encounter. And so those services are also provided. So then the patient, upon checkout, they drop their little badge into a bin that's in the wall, and then that becomes sanitized and the room gets cleaned based upon whatever was going on in there. And then the whole process kind of repeats itself. And so we could have anywhere from 1 patient to 11 patients at a time, because that's how many rooms I got, unless I float over to Doc Health. And so, it's that fast-paced turnaround like that. Does that answer the question?
Yeah, definitely. And actually, I want to touch on that idea of how fast-paced it is for you and your team. Is that stressful? How do you and your team manage that stress, even on like the work-life balance? And then lastly, is there a lot of turnover because of that fast pace, do you think?
There's actually a waiting list to get into this department.
Oh,
So
okay.
no. And I think it stems from, there was amazing leadership before me. I can't take credit for that. I've only been here since April, but they haven't left me, so I'm doing something right.
Okay.
This is a really good culture. We have high functioning folks, and we push people to work to the top of their scope. Those MAs and LPNs that I have working in this unit, they are champions of supply ordering. They're highly engaged and invested with each other. And that's essential as a healthcare team. You need to be able to trust each other, and you need to have great relationships. They work 12-hour days because we're open 7 days a week. So they're working about, if they're full-time, that would be like 3 days a week, and they're getting that time off. We combat burnout by making sure, as a leader, it's important to check on engagement, check on how your team's doing. As a leader, it is my responsibility and my oath to my team that I'm not going to let them experience that level of burnout or busy. I keep a set of scrubs in my bottom desk drawer. There are many a times when they don't even ask me, but I just go to the bathroom, I pop them on, and I come out and I room patients. Nothing is above or below me. I am never, and that's what makes me a different leader, is I'm never going to expect anything from my team that I'm not willing to do myself. So the first day that I did that, I thought a couple of them that they're going to have a stroke. I was out here, I was like, I'm going to room this patient and just show me where this is. And then they did labs, and they're like, do you know how to draw labs? And I'm like, do you want me to go to my desk and get out my competency packet? But yes, I can draw the labs. So do the labs and serve the patient. And that really helped early on. Because we're busy in the pandemic, and they're probably thinking, oh, great, we're in the midst of a pandemic. We got this lady who, what does she know? What is she about? She tells us these things, but is it truth? So you got to prove yourself. And I can tell you that rather quickly, things turned with my team, and we were instantly bonded, and a different level of respect was bestowed upon me due to carrying out those actions. So we take really good care of each other. If they have an absolutely terrible day, even on the weekends, if we are experiencing high volumes, I will get them lunch or go get them dilly bars. It's whatever forms of communication and appreciation that they recognize that I know that they're doing a good job. It's feedback. Even when we have something that doesn't go so good, okay, let's talk about it. This isn't a punitive thing. Let's figure out where we went wrong, and let's figure out how we prevent it from happening again. So it's great communication. It's celebrating our successes, learning from our failures, and truly being a collaborative team.
Mhm. Oh, that's fantastic. It really, I think, to sum that up, is it sounds like you lead by example. And I love that idea of, I'm not going to ask my team to do anything that I'm not willing to do. I think that is the mark truly of a great leader. And so some of the students are wondering, what is it you love most about your job then?
I love that nursing has truly lended itself for me to have several different opportunities. There are days that I really miss being that bedside nurse in that hospital, either holding the patient's hand that's taking their last breath, or, in that thrill and hustle and bustle of cardiac events and codes. But I love right now about my job, I speak very highly of Advocate Aurora. I came in the middle of a pandemic. This is a very scary time, and they have fulfilled every promise that they gave to me. And this organization puts patients first and also puts their staff first. And I think what's most rewarding, or what I love the most, I do miss some of the patients, but I can have that experience whenever I want it. All I got to do is come out here and help them out. But I love to watch my team grow, helping remove barriers that drive them bonkers and helping to put them on the right path and for them to achieve their goals. I have an LPN and an MA who are graduating with their RN degree, and one wants to stay here on the unit and the other doesn't want to leave the unit, but she wants to experience other things. And so that's been a really emotional journey for her. But we have worked through that and told her, go ahead, go try it. If it doesn't work, you can come back. It's fine. So I just love being able to foster and mentor and grow people and help them to achieve what they want to achieve. And first and foremost, just being able to impact patient care, better serve our communities and make sure that people are getting the care that they deserve.
That's awesome. Yeah, it really sounds like you're living out your mission of like having that larger impact. So thank you for that. That's really wonderful. All right, this session's just flying by for us. So I'm going to dial it back to kind of that beginning of the career. You had those experiences, and we'll talk about the education piece in just a second. When you decided you were going into healthcare, did you have an idea of what type of nursing you wanted to do, or how did you make that decision about kind of that first department you were going to go into? What's the decision maker in that?
So I did not know where I wanted to be. I am the first person in my family to obtain an advanced degree. So I grew up in poverty, and that's something that really changed me and set me aside. At first I had contemplated maybe doing more of a community-based nursing and trying to develop programs that helped impoverished people, help to mitigate some of these disparities. But really in my path, what changed is, when I got plugged into Theta Care and I had great leaders surrounding me, they kind of helped to guide and lead me in the right direction. I started as that dietary tech, and then in that same, switch to that entry level CNA, you have to get that experience. And oftentimes that's in long-term care, but I learned so much there. And then expounding off of that, that leader ended up moving over to our hospital. So it's a connected system. And so she reached out to me and said, do you want to grow and go? Are you going to come over here with me? So she was probably the catalyst to get that going. And I learned, general medical, people are afraid of it, or, there's a stigma associated with that type of nursing, but it really lays a fantastic foundation. You really need to be able to understand basic patient care, disease process. Once you get that down, you can go anywhere, and so it was just so fascinating for me to learn disease process. And I just was learning so much. And I think that's why I didn't leave for 18 years, is at each level, it was a different degree of understanding. And there was so much process improvement and things that I was entangled with that they just kept me hooked for a while, So there really wasn't like an aha moment. It was just kind of the path and my own personal fascination. There are these people, and I mean, my care team could be composed of 6 or 7 patients that, I have a fresh mom, OB float over, and there's a baby in this bassinet, and how do you deal with that? And down the road, there's an old man taking his last breaths, and I got a pneumonia here and a stroke here. You have to be on your game and being able to learn so many things and build that strength of my basic medical background and just skills. That's just where I ended up, and I'm glad for that, because it's made me a better leader and a better nurse, and putting in that time.
Yeah, that's wonderful. And students, I think just from these conversations we've been having, you don't have to have it figured out, when you're in high school, or even when you leave high school to go into your training. But as we are talking with a lot of students who are at that stage, what are some things they can be doing, whether it's classes, organizations, activities? What can they be doing to be preparing themselves and sort of investigating this as a possible career path?
To prepare yourself, I think it's important that you start to focus on some of your sciences and your maths, so anatomy and physiology. As much as I didn't like it, chemistry, I shared with you, I was being vulnerable, that I came from an impoverished family. I had to work really hard in school. School didn't come easy. I'll tell you, when I started, I failed A&P in college because I wasn't dedicated enough the first time I took it. And it was a wake up call of, okay, you don't have the bucks to be wasting here. So you better figure out what it is you want to do. And after I attained my LPN degree, I was kind of like, I don't want to learn. I don't want to go back to school. But now look at me, the master's degree. So you get hooked. But I would really be focusing on oral and written communication because it's really important, as we discussed. I can't overemphasize it. Take some professional development, do some personality tests, kind of figure out where your niche is. I know COVID changes things, but maybe if you're interested in a healthcare career, try to figure out if you can get in to do a job shadow. Usually healthcare agencies will let you come in for about 4 hours. There's a little bit of preemptive work that you need to do just to validate that you are up on certain things and it's safe for you to be in that patient care, but explore that and don't be afraid to fail. Like I said, I could have given up. I could have, it was hard. I worked full time while going through all of my degrees, and it is exhausting, but it is so worth it. So I would focus on your sciences. If you're not doing as great, just keep pushing through. Find a study buddy, talk to a counselor, be thirsty and eager to learn, and don't be afraid to fail. It's okay. You're not going to have it figured out. And you may enter nursing. I mean, I remember being in nursing with some colleagues, and I tutored for a bit because it came very natural to me based upon the environment that I was in. And I just remember this poor guy, he could not get the sterile gloves. And he would get so frustrated and rip them off. And he's like, I don't think I could do this. And I'm like, well, I agree. If you can't don on sterile gloves, then this probably isn't going to work, buddy. But, let's try again. Let's take a little walk, take a little breath. But you just have to be patient with yourself, find your journey, figure out what your interests are. You can go into public health or OB, general medicine, ER, ICU, leadership, work for the Joint Commission. That's my retirement goal. I'm going to do this leadership thing for a little bit, might eventually land a director job. Somebody takes me, I don't know. For right now, this gig is pretty good here in the urgent care. Love my team. I'm doing fine. It's a pandemic. I don't really think I should be going anywhere anytime soon, but when I retire, I'm going to, go travel the world and work for the Joint Commission and bust people on what they're doing wrong. I think it's going to be amazing because I personally had, heart palpitations when they show up on my doorstep. So I want to be like the opposite person, maybe giving them that.
Awesome. You have a vision. I love it. I truly love it. You mentioned that you were working full time throughout your schooling. Were you able to take advantage of like tuition reimbursement or have your schooling at least have some help paying for schooling while you went through?
Yeah, I did pretty good. Due to being impoverished, my LPN degree was covered because my parents had nothing. But when I started to then, and so I lived in a little old lady's basement and I cared for her. So I was a caretaker and I worked full time those dietary tech and CNA jobs. And then with full-time status, I was able to capitalize on some tuition reimbursement. For a while, I did work 2 jobs because I was trying to figure it out. So I actually worked for like a domestic abuse shelter within our local area because I was trying to draw the parallels between some of that community stuff going on in addition to maybe public health nursing. It's insane times and how you do it. I don't know. Like I worked in Wisconsin and I lived in Upper Michigan. So like I can recall my 3rd semester of RN degree, I would be home Monday through Thursday, but Thursday we would have these clinicals for mental health up in Marquette. And it would be like, go to that clinical, spend the night in the hotel, get up in the morning, do the clinical. I would drive the carpool back to the state border, drop them off, continue on another 2 hours so that I could get to work, change my clothes in the car, literally, and then go in and work a night shift. Probably not safe. I never had any harm, but how you live through it, I mean, it's amazing what you can do. And I don't know how I did it. There are different scholarships. You guys you have that opportunity. I know that it's time consuming, but we're in the midst of a pandemic. Take some time on a Saturday or a Sunday or whatever you have allocated and apply to as many as you can, because you can't get them if you don't try. All they can do is say no. I mean, just throw your hat out there. And sometimes it's an essay, sometimes it's a story, sometimes it's a vision. There's lots of foundations tied with healthcare agencies. So try for scholarships. get connected to a healthcare facility or a different job that may offer some level of tuition reimbursement. I know that the government offers healthcare repayment. I've had to pay for my RN degree and my master's degree, and I'll probably be paying on that till I retire. But after a certain number of years, they do offer like a forgiveness. So there are options. Don't be afraid of the debt that you're going to accrue, because it'll work out.
Yeah, definitely. Oh, those are all really great tips to be looking at students if you're just trying to figure out how to make this work as you move forward into your future. Well, students, we have a link to a survey that Julie posted in the chat. If you would please click on that today and make sure that you let us know what you thought of our session. And Amanda, any last words of wisdom for these students as they're thinking about this as a potential path?
My words of wisdom are just to, ask questions, lean on your coaches, your mentors, try to figure it out. Don't be afraid. Don't be afraid to try things. And if it doesn't work, just try again. Don't give up on yourself. You need to just figure it out. Just be true to you and figure out what you want and develop that dream. Maybe you start this and you think, yep, I'm going to be a nurse, and you get in here and you're like, wait, I can't handle vomit or blood or any of this. This is not my cup of tea. Then, odds are you're going to find something else or work in a role that doesn't require you to have to deal with that. So be connected to a leader, work on your communication. Don't ever bring me a resume with LOL or any of this stuff, because I'm going to be pretty upset. Try. And the water seal is important, your water seal paper. So put an effort forth, sell yourself, and remember the personal things that we can't teach you. I can teach you to be that brain surgeon, but I can't teach you the basic fundamentals of kindness and just being a good human. So
Wonderful. Oh, Amanda, that's fantastic. I have a feeling you'll see some of these names coming across your desk someday, because this has been just a really enlightening conversation today. So thank you so much for your expertise and your time today.
you're welcome. Thank you for having me.
Absolutely. Take care.